This is Healthcare Now Radio's Trending Now. I'm your host, Jared Johnson. Join me and my guests as we discuss the latest topics that are in the news or getting social media traction in the universe of healthcare and health IT. It's a fast-paced 30 minutes, so sit back and listen as we kick off the show with what's on trend now. Today, I'm speaking with Stacey Emmons, Director of Patient Outcomes and Adherence at Walgreens. Stacey, welcome to Trending Now.
Hi, thank you. I'm so excited to be here.
Let's help our listeners get to know you a little bit better. What would you like them to know about you personally or professionally?
Sure. I am a pharmacist by training, and have been a pharmacist for 17 plus years now. I've always had a passion for community pharmacy and the role that pharmacy plays in healthcare of our patients. I was even around when pharmacy started giving immunizations out of the pharmacy and have been thrilled to see that transition over the years. My current role is that I lead a team of pharmacy professionals at Walgreens. We design, build, and deploy services for our patients that helps them stay on track with their medication, really focusing on medication adherence for chronic disease states. Personally, I am a mom of 3. I have a set of twins and a teenager. So those 3 keep me busy. I'm also married to a pharmacist. So a lot of pharmacy talk in our household.
That's great. That's great. It's a lot of fun there, I'm sure. I imagine along the way, the answer might be different depending on what point of your career you think about this. But I like to ask our guests about a piece of career advice that they've received along the way that's either helped them make a choice or helped them not make a choice. You know, something that has just stuck with them to help them and kind of guide them to where they are today. Is there something that comes to mind?
Yeah, I think for me, it has always been the advice to stay true to yourself and what you're passionate about. That has guided me throughout my entire career, even thinking about pharmacy as a career, moving into pharmacy and then thinking about all of the things that pharmacy can provide. I've always been really passionate about the different areas that pharmacy can step into and the way the community pharmacy is available as a healthcare provider. So from being a practicing pharmacist myself to moving into a field leadership role to where I am today and helping design these programs that are available in all of our Walgreens locations, impacting all of our patients. Being true to myself and the passion that I had has really helped me stay excited about the work that I do and excited about my future.
Oh, well, I will say anything that helps us stay excited about what's going on is fantastic because we can all use that. I think there's a general collective sense of embattlement, I think is kind of the word for it. Just first off, for all members of care teams, as well as all those who support them, anyone who is patient facing at all, that seems to be the word that I hear the most, which is embattled. And so anything we can do to help connect with one another, support one another, and help remind them of why we do all this work is outstanding. And thanks for sharing that. You know, what I'd like to do today, that might really even transition into our first topic here, which is just a general state of how COVID has changed consumers' approaches to healthcare. The pharmacist plays an important role there, but maybe we can even back that out in terms of just what we've seen these last few years and how things have changed for consumers. How do you think COVID has changed consumers' approaches to healthcare?
Yeah, I think that COVID really accelerated some of the emphasis on pharmacy, what pharmacy could play, the role that pharmacy could play. We think about during the pandemic, how things were shut down. Pharmacy was one of the few places that members of the community could go for their healthcare needs. So pharmacy's always played an important role in healthcare, of course, dispensing the medications, ensuring safe dispensing of medications, making sure there's not interactions with what you're taking. But that was really amplified during COVID. When we think about all of the COVID immunizations that were given, the role that pharmacy played in testing for COVID, that really amplified the licensures of pharmacy, not only pharmacists, but technicians, what they could do, the full scope of their license, and really then pushed us into, like I mentioned, the digital world where we think about convenience. How can we get access to the pharmacy? How can we get access to a healthcare provider? And how can we do that on our own time? So we as a country leaned on pharmacy during that time. And we're looking at how we can continue to play a role in the healthcare ecosystem as we continue in I'd like to say, post-pandemic world. But in addition to what we saw originally with COVID, we continue to see that pharmacy is really, truly a part of the healthcare team. Not that pharmacy is looked at as an or to other providers, but how are we an and to that full suite of healthcare services that are provided? Thinking about when you start a new medication, consultations that start there. It could be a new disease state that pharmacist is helping train the patient how to take care of themselves through medication, lifestyle modifications. And then thinking about as you're in a healthcare regimen, you know what medications you're taking. How do we help ensure that you're taking those medications as prescribed? We know that if prescriptions are taken as directed, then you're going to get the benefit that prescriber is looking for you to receive. And how do we support that patient in being able to take their medication correctly, get the benefits from that medication that we expect them to get? And not only is pharmacy a good place for medication specifically, the adherence I've talked about, but also back to the immunizations. Yes, you can receive your immunizations at a Walgreens pharmacy, but in addition to that, our patients can go and get a consultation from our pharmacist to understand what immunizations is it that they need. And then even thinking about how do we remove barriers to getting those medications. One such way is thinking about cost. Walgreens offers different cost-saving solutions from financial assistance programs to various discount programs to make your prescriptions more affordable. In addition, we have delivery options that could be available if transportation is an issue. So all going back to saying COVID opened the eyes of the availability of pharmacy and the role that we have to play in the ecosystem, and how do we continue to play that part as part of that healthcare team.
Yeah, that part has a lot to it. What you just described to me sounds like a great effort in addition to all of the care that you're providing, but it involves a lot of education. It involves a lot of communications. It involves a lot of building trust or restoring trust and helping people understand how a change in their behavior can benefit them. You mentioned a lot of benefits to the care team and to the patient, the person who is, has the medication now in their life. There's a lot that involves. I know not all of those things are perfect. There are gaps in a lot of those areas, and COVID did reveal some of those. What gaps have you seen since those early days of the pandemic? What gaps did COVID reveal in healthcare, and where has Walgreens seen opportunities to fill some of those gaps?
So we know provider shortages are here. That was something that was amplified during COVID, and the demand for healthcare really outpaces the supply at times. So it made it clear that pharmacy could step in, and beyond filling prescriptions, we could help be a partner in those immunizations, in those testing. Now we think about even further, pharmacy is able to, based on state regulations, help do some of those gaps in care tests. Looking at A1C testing, we can help a patient understand what their A1C is, which is really important in a patient with diabetes. Thinking about managing blood pressure, going into the pharmacy for regular blood pressure screenings is an opportunity in some areas. Continuing to look at legislation that allows pharmacy to, again, step in and fill some of those gaps so that we can be an opportunity for patients that may not otherwise have an opportunity to get some of those testing, screenings, immunization, or consultations done in another part of their healthcare team.
I love that. Well, let's focus even more on that role of the pharmacist. If you think about how they communicate their role, especially to someone who maybe is a little resistant to medication, someone who knows they need to use it, but maybe they just don't want to. A pharmacist plays an important role here. And we don't always describe it this way. We probably should, but we should think of it as a pharmacist helping someone manage their health, not just providing a prescription. What do you think about that? Do you think the pharmacist helps manage people's health And if so, how has that role shifted recently?
I definitely think a pharmacist is someone that helps manage someone's health. I even think back to my days when I was a practicing pharmacist and the relationships that I built with my patients. And that relationship that you build, knowing somebody's name, knowing their pet, those little pieces really do help you develop that relationship and that trust. And so when we think about what pharmacists are trained to do, one of the largest pieces that they're trained to do is to have that consultation. That's what differentiates us, is having that consultation with the patient to understand how the medication may fit into the overall disease state management process. Because the medication could just be one small part of many things that they're having to think about and adjust in their lives. So how do we make it easier for the patient to understand what that new medication is going to look like? If they have side effects, that might be normal. And it's not something that they might necessarily have to live with. It could be something that we flag for the patient. Hey, you may experience this, but if you do, let us know. That's something that we can either give you a treatment for or another remedy to try to help mitigate those side effects. Or it could be something that we need to engage another provider or prescriber to help make a change there. So really taking that holistic approach to how we think about the patient and being that care provider versus it being a transactional type conversation, and opening up that ability to have those questions. When you get home, you may not think in the moment what question you have, but when you get home, being able to call back, hey, Stacey, I forgot to ask you if I can take this with grapefruit juice, or I left my kid's medication out last night. Is it completely ruined now, or is this something that we can give to him? So being that person that can come back, they can come back to and really think of as someone that's there to help them is really important, and something that I think community pharmacy has been doing for a long time. But with the access that there is today and being one of the most accessible healthcare providers that there are, that continues to be a differentiator in pharmacy and being able to have those conversations freely with the pharmacy team.
I love that. And that's a great example of what we're talking about. For our listeners, if you're just now tuning in, I'm Jared Johnson, and you're listening to Trending Now on Healthcare Now Radio. I'm speaking with Stacey Emmons, Director of Patient Outcomes and Adherence at Walgreens. Let's get right back into this, Stacey. I'd love to hear a couple of things about some of the ways that Walgreens helps to manage care. Let's talk about technology's role there for a moment. What does Walgreens do when it comes to using technology to help manage care?
Yeah, I think from a consumer perspective, one of the biggest benefits is the Walgreens mobile app. So something that's easily downloadable from the Apple Store or Google Play. It is a one-stop shop to really, on your own terms, manage your care. So not only is it going to give you the full view into you and your family, if you set it up that way, all of their prescriptions, it also allows you to refill at your own time. There's an option to set up refill reminders or ready notifications. So if your refill is coming due, we're going to let you know it's time to refill your script. If you have a prescription that's been filled, you're going to get a notification that prescription's ready to be picked up. In addition to that, one of the coolest features, I think, is that it gives you 24/7 access to chat with a pharmacist. So if you wake up in the middle of the night, your local pharmacy is closed, you can pull up the Walgreens app, start texting back and forth, having that conversation with a pharmacist at your own convenience. In addition, you can set up your prescriptions for delivery. There's the option to even set up pill reminder is what we call it, but a reminder to let you know that it's time to take your medication. Really convenient for those 3-4 times a day medications. Get a notification, hey, it's time to take your medication. That's all set up on the app. One really fun story that I had over this past weekend that, I take for granted what's on the Walgreens app. I live it, I breathe it, I know it. I was out of town with a friend and she was really upset because she didn't think she was going to make it home in time to get her medication. And she really needed to start it that day. So I shared with her, hey, we have free same day delivery in some markets. happened to be her market, and we were able to get that set up. She has since told me of several different people she has shared that with and is just amazed that that's something that you can do, and the convenience that Walgreens offered, which was a simple click within the app. So I found that to be something really encouraging, and continue to talk more about it to be able to get the medication in the hands of the patient. But really, that digital app is going to be one of the best tools of being a Walgreens patient. It has a lot of great information on chronic disease states, again, the pharmacy information, and even moving into the front end of the store, there's some cool one-clicks about ordering supplies, if you, especially OTC medications, thinking from a pharmacist lens, if you need to get your prescription, thinking about flu season, respiratory season, you might need your prescription, but you might also need some fever reducer, cough and cold medications. Add it all right there, have it delivered curbside, come into the pharmacy and pick it up. Really great, convenient options. And it's something that I think that we have come accustomed to over the past couple of years. We can order our groceries, pick them up. You can now order your prescriptions and pick them up. You can order your coffee, have it ready for you when you get there. So just really playing into the needs of the community and being able to have those opportunities there.
That's outstanding. Well, the thought of just having help available during either off hours or, like you said, somebody arriving somewhere after the typical time when they might not be able to pick up their medication anymore. Those are all meeting those consumers' needs. And it's not just a desire for convenience, it's an expectation that's involved nowadays. And that is one of the things that's driving innovation, consumer-minded innovation in things like pharmacy. It's great to hear about that. I'd love to hear also just about the approach for patients with chronic conditions. This is a very different subset than those who are fortunate enough to not have to deal with chronic conditions on a daily basis. It affects every aspect of your life. So when you are a patient or you're a caregiver or a loved one of a patient with chronic conditions, it takes, I feel like, a different level of help and care. How do you think we should be approaching patients with chronic conditions?
Yeah, absolutely. Thinking about chronic conditions, it really does require you, potentially your caregiver, your family, to invest a lot of time and energy to managing it. So thinking about that comprehensive total healthcare approach, we're focusing on helping to keep you healthy and happy by understanding your overall health profile. How can we help improve that specific condition you have? And if you happen to have multiple chronic conditions, how do we think about those together and ensure that we are supporting those from those different lenses? It definitely goes beyond just a simple blood test or treating the symptoms. Our goal is to help reduce symptoms, of course, but also managing that condition and its progression. And I talked about it earlier, but I'll give another plug here again. Ensuring that a patient is adherent to their medication is really important to ensure they're getting that full benefit. If a provider thinks that a patient is taking this medication 3 times a day, and they're not, and they go to a follow-up appointment, they may not realize that medication, it's not that the medication isn't working, it's just not being taken as prescribed. So it's really important for that full care continuum for us to help support that patient in taking it correctly. So then the provider can make decisions based on that. In addition, when you receive a diagnosis, you want to work with a team to help to manage it. And as a part of that healthcare team, our Walgreens pharmacists are there to counsel on the appropriate use of the medications, how to manage any of those side effects, like we discussed. And then what happens if they miss a dose? What happens if they do have a severe side effect that makes them stop taking it? Really just thinking about that whole patient. We do engage with our other healthcare providers, with the prescribers, with the other pieces of that patient's care team, so that we can help fill in any of those gaps, provide any of that information, identify any areas for opportunity, and engage with those other partners in the care team to pull it all together to take the best care of that patient. And then thinking about the education of our pharmacists. Of course, they all have their pharmacy education, the pharmacy school that they went to, but we continue to invest in and provide additional training for our pharmacists in the chronic care space. So whether that be diabetes, cancer, hypertension, cholesterol, organ transplant, HIV, there's additional refresher, updated guideline information that the pharmacists are provided so that they can get the best possible care because our pharmacists are understanding the unique needs that are associated with that chronic health condition.
Oh, that's a great example here. Well, I'm going to put on my own consumer hat and ask our listeners to do the same. And since we have the fortune of having you on, I'd love to mention the fact that we're approaching immunization season. And I'm wondering what you'd like us to know in order to be prepared.
Absolutely. There's quite a bit. But first and foremost, you mentioned it. We are getting ready to hit respiratory season. We have, flu coming up, COVID still here, RSV had a big surge last year. How do we combat that? The good news is that Walgreens does offer flu, COVID, RSV vaccination appointments nationwide. So flu is available for everyone ages 3 and over. RSV, which is new, it's been out, I want to say a month about at this point, that is eligible for patients that are 60 years or older. So that is one thing I definitely want everybody to know. If you're in that age group, there is a new vaccine that's available, something that hasn't been around in the past and something that is highly recommended. In addition, COVID, of course, we should have the new COVID vaccine in the coming weeks, waiting on some further information there on the exact timing, but COVID will be a new vaccine this fall that we encourage eligible patients to receive. But then even in addition to the vaccines, there are treatments that pharmacists in some areas can provide, not only COVID treatment, but also flu treatment in some locations. And in addition to that, the testing. So thinking about getting tested still for COVID, it is still there. Tests are still available. And in some locations, we'll even be offering tests, our pharmacists completing tests for flu. So a lot that can be done there, a lot of preparation to try to avoid getting any of those respiratory illnesses, but then the ability to assist patients if they are unfortunate enough to come down with any of those respiratory illnesses this fall.
Oh, I appreciate that. That's an important part of this conversation, I feel like, and one that's important for each of us to hear. Well, as we start to round out the conversation, I have a couple questions. I'd love to hear just where you hope all of this work gets us. I think it's safe to say there is a lot of work that happens in healthcare to help people live healthier, be well. I'm just wondering what you think the destination could be. And we put it on a short-term horizon. So what do you hope that healthcare looks like? And how do you think that's different in 3 to 5 years from now?
I think we saw such an acceleration over the past 2 to 3 years. I anticipate and hope that we continue to see that acceleration continue, where pharmacy can continue to be a key puzzle piece in the health team plan for a patient and fill in some of those gaps. We think about, again, provider shortages, provider deserts. How can pharmacy be a place that helps to fill in some of those gaps that may exist? In addition, continuing to develop on technology availability, thinking about virtual care. How can pharmacy play a role there as well? Really just helping our patients to receive the care that they want and that they need in a convenient way so that we can continue to deliver the care that we expect to deliver for our patients.
Awesome. Is there anything else we haven't mentioned? Anything else you'd like our listeners to know about that we haven't already discussed?
I don't know about anything else, but maybe bringing it back to a couple of key points. I just talked about immunizations. I'm going to put another plug in there. Immunizations helps prevent the spread of these respiratory illnesses. So get out to your Walgreens, get your immunizations completed this fall. In addition, think of pharmacy as a part of the healthcare team. We take a whole patient approach. We help with everything from health and wellness to chronic condition management, here to help you understand why it's important to take your medications, how to address any barriers that might stand in that way, and how to really be that accessible healthcare provider that you have grown to know and trust. And then third, now more than ever, technology is here to support your healthcare needs. Lean on that. Look at the options when it's available. Help make it easier on yourself to take care of your healthcare, and know that there is technology there that's going to support you and access at all points in time.
Outstanding. I really appreciate your time, Stacey, and I just want to thank you for the conversation and helping us explore what's on trend. There's so much here. We can keep going, and you've opened up a lot of thoughts here for me, not only just acknowledging the role of the pharmacist in so many different aspects of care, but recognizing the evolutions that have happened and what we as everyday people, what consumers can do to help play our part. I do consider things like considering your immunizations, getting those done, things like that as each playing our part. It's been a pleasure to speak with you. And I just want to thank you again. Thanks so much for joining us. And I really appreciate this perspective that you've been able to give us.
Yeah, thank you so much. It's been great.
With that, that's a wrap for today. I want to thank my guest, Stacey Emmons. To learn more about Walgreens, you can find them at www.walgreens.com, and you can see if there's a store near you and where you can go for that. You can learn more about today's show on our program page at healthcarenowradio.com, and make sure you follow the show's hashtag at TrendingNowHC. Until next time, if it's happening in healthcare and it's now, it's on Trending Now.